Hi, my name is Ryan, student at Yale College. Today I'll be performing the task of drawing up insulin to give to our patient. First thing we're going to do is we're going to check the doctor's order. We'll go for six rights of medication administration: right patient, right medication, right dose, right time, right route, and right documentation. We're going to verify the doctor's order with the EHR. We'll go over our dosage. We got 2 things of insulin. We've got regular insulin, it's gonna be 4 units of that, and NPH 8 units of that, for a total of 12 units. And we're gonna have a secondary nurse who's gonna come in the room later to verify that with us. All right, so first thing we do is we're gonna knock on the door, enter the room, close the door for patient privacy, do hand hygiene. Hi there, my name is Ryan, I'll be your nurse today. Can you tell me your first and last name and date of birth? And I'll confirm with the wristband, verifying the 2 patient identifiers. Hi there, nice to meet you. Doctor's ordered some insulin for you today. Do you have any allergies? No allergies, no food, no medication, none of that? Okay, great. We'll check the blood sugar. Blood sugar is 150. All right, so doctor's ordered 2 types of insulin. We've got a short-acting and a short-acting and short-action and a long-action insulin, and we're gonna be combining them into one syringe and give you 1 injection. So our short-acting is the regular insulin. What it does, it helps draw the glucose into your cells, and your cells will convert that into energy for your body, and using this will lower your blood sugar. It's used for diabetes to lower blood sugar. The side effects are headache, redness at the injection site, and increased hunger. Some adverse effects, any of the adverse effects that I go over, if you have these, we want you to tell us immediately. We don't want to delay any care for that. They aren't common, but they can happen, so we need to know. Adverse effects for the regular insulin are numbness and tingling, tachycardia, and swelling or peripheral edema in your hands and feet. For the NPH, it works very similar to the regular insulin. It takes longer to kick in. Oh, and the regular insulin we want to give about 15 to 30 minutes before you eat, okay? The NPH, it will last you for usually 2 for the day, so about half the day for this, and it takes it works the same way as regular insulin, but just takes longer to kick in and lasts longer. Side effects for that are hunger, increased thirst, and some swelling or your water retention. Thank you. Couldn't remember what it was called. My patient was talking back to me and letting me know. The adverse effects, again, for this one that we want to know is you've got dizziness, the numbness and tingling, and also low blood sugar. So again, any of these that you feel, you need to let us know immediately. Do you have any questions? No? Okay, well, let's get started. So perform hand hygiene again. I'll put my gloves on. These vials, I would be taking them into the patient's room. If they're refrigerated, I would let them come to room temperature. I'm going to check the expiration date for both of them. Expiration is good. Also look for any sediment or cloudiness. I'm going to roll them in my hands. Put them on the table. I'm going to clean the top of them and let that dry. Let that dry. I'd be throwing this away. So first we've got our syringe from new package. I'm going to, I have my nurse in the room at this moment that's going to go over everything with me. And you might feel stinging or burning at the injection site, okay? So my nurse is going to verify everything here. We've gone over the order, and how much for each of each medication. So first I'm going to be drawing up the NPH. So I'm going to draw with the cap on the 8 units of air. I'll show it to my nurse, and then I'll show for the camera. Hopefully you can see that. I'm going to remove the cap. This is dry now. I'm going to, without touching the needle to the medication, I'm going to insert the tip of the needle and inject all 8 units of air in there. Move it out. I'm going to draw up 4 units of air for the regular insulin with my nurse. And for the camera, 4 units there. And we're going to do this one and invert it. Invert it and draw up the 4 units. Remove it and tap it to get rid of any air. There we go. There's our 4 units of regular insulin. Checking with our nurse again. Verifying for the camera. And then now we're going to do it with our NPH. I'm going to drop the 8 units for a total of 12 units in this. And my nurse agrees. I'm going to draw up. There's no air in this one. So there we go. Confirm 12. The 8 added for 12. All right. And voila, that is how we drop the medication administration. If we did this out of the patient's room, I would put a label on this with the patient's name and the medication and the dose. We did it at the bedside, so I'd be ready to give the injection now. I'm just going to recap my needle. Oh, it's moving. And voila, we are done.